The following presentation is an academic research report on atherosclerosis-induced myocardial infarction, or heart disease and heart attacks. One guarantee in life is that each and every one of us will die someday. However, living a healthy lifestyle, which includes eating a nutritious diet, drinking plenty of water, exercising, getting enough sleep, and managing stress levels can prolong our lifespan. Varying from country to country, life expectancies range from 50 to 90 years of age, with developed countries tending to have higher values. The leading cause of death in the United States, as well as most other developed countries in the 21st century, is cardiovascular disease, which kills over 600,000 people each year. There are many different types of heart disease, including coronary artery disease, congestive heart failure, arrhythmias, and heart valve issues. But the most common form of the disease is coronary artery disease. This condition is the result of atherosclerotic plaque buildup in the arterial walls, narrowing the vessel's lumen, or opening. This video will cover the physiological mechanisms that drive arterial plaque formation, the rupturing of these plaques, myocardial infarctions or heart attacks, as well as preventative and even reversal methods for the disease. The human body is made up of many tissues and organs that function in a variety of systems, one of which is the cardiovascular system. Consisting of the heart and countless vessels like arteries, veins, and capillaries, the cardiovascular system transports blood around the body, delivering nutrients to and removing waste products from tissues. Under normal, healthy conditions, the walls of these vessels are dynamic and free of any obstructions. Atherosclerosis is defined as the deposition of cholesterol, calcium, fibrin, cellular waste products, and other fatty substances into the endothelial walls of arteries. Platelets, as well as monocytes that become macrophages, migrate to the site of atherosclerosis. These macrophages engulf cholesterol but do not leave the plaque site, so they become foam cells that contribute to the plaque buildup. Over time, the size of this fatty plaque in the arterial wall will grow in size if the causal conditions are maintained. Factors such as the size of the plaque, the stability of the thin fibrous cap, and local inflammation increase the likelihood that an atherosclerotic plaque will rupture. The rupturing of a plaque is the spilling of its fatty cellular contents into the artery, and this can lead to a deadly blood clot or fatal coronary thrombi. It takes just one thin, weak area of the fibrous cap to be compromised for the harmful rupturing process to occur. After the plaque ruptures, platelets in the blood naturally form a clot or thrombus at the rupture location, and this clot can block blood flow to the artery's tissues locally or further down the vessel if the clot breaks off into the bloodstream. In a myocardial infarction or heart attack, the atherosclerotic plaque ruptures and forms a clot in the coronary artery. This clot occludes blood flow to the heart, which starves its tissue of oxygen, leading to cellular death. Risk factors for this arterial plaque formation include hypercholesterolemia, elevated LDL cholesterol, low HDL cholesterol, hypertension, physical inactivity, cigarette smoking, obesity, and diabetes. Out of all of these risk factors, elevated serum cholesterol is the only direct cause of atherosclerosis, while all other risk factors are indirect and simply accelerate the plaque formation process. In other words, an individual with all of the risk factors, excluding high blood cholesterol or hypercholesterolemia, is not expected to develop atherosclerosis. The Framingham Heart Study demonstrates the extreme rarity of an individual with serum cholesterol levels of less than 150 milligrams per deciliter developing atherosclerotic plaque in their arteries. Many controlled, interventional, metabolic ward studies have proven that dietary saturated fat, which is found in animal products like meat, eggs, and dairy, as well as oils like coconut and palm oil, has a direct causal relationship with the serum cholesterol levels of subjects. Restricting dietary intake of saturated fat from animal products and oils, and thus preventing or treating hypercholesterolemia, not smoking cigarettes, maintaining a healthy body weight, preventing or treating hypertension, and being physically active all decrease one's risk of developing arterial plaque and suffering a heart attack. Every person has fatty streaks and some degree of atherosclerosis in their arteries because the plaque formation process begins as early as childhood and tends to progress throughout one's life. Fortunately, many groundbreaking studies have demonstrated that atherosclerosis is, in fact, reversible without drugs or surgery. The treatment that can dissolve arterial plaque and restore artery function in up to 99.4% of patients is a whole foods, plant-based diet lacking in saturated fats, animal products, and oils. The leading cause of death in the United States and many other developed countries is preventable and even reversible with healthy lifestyle choices. In conclusion, the leading cause of death in most developed countries, including the United States, is heart disease. The most common form of this condition can occur when accumulated atherosclerotic plaque in the coronary artery ruptures and a blood clot blocks blood flow to the heart tissue. This arterial occlusion prevents the deliverance of oxygen to the heart tissue, leading to cellular death, which is known as a heart attack. The good news is that the development of this arterial plaque can be prevented and the disease can be reversed by lifestyle modifications such as proper nutrition, weight management, blood pressure management, avoiding cigarette smoking, and exercising regularly. Thank you all for watching this presentation, and I encourage you to explore all of the references provided in this research report to learn more about this condition. It is the most common cause of death in most developed countries, yet it is preventable and even reversible with healthy lifestyle choices. Stay tuned and subscribe for following videos.